My first question to you is, can you provide a brief overview of the most common causes of back pain?
Yeah, so the most common cause of back pain is basically disc degeneration. We have disc in human body. Normally, we have 23 discs. So disc degeneration is one thing that basically means that the flexibility or the load bearing capacity of the disc has gone down. So whenever there is a disc degeneration, that causes back pain. Not every disc degeneration is painful, but disc degeneration in presence of poor muscle tone or poor posture invariably leads to back pain in young age. Except for disc, there are other pain generators in the spine also, like the facet joints, or simply we can say the joints of the spine, sometimes they become painful. Thirdly, sometimes in condition where the bone is not proper or it is slipping forward, like in spondylolisthesis, that can also cause back pain. Next conditions are like metabolic problems like ankylosing spondylitis or rheumatoid arthritis. Then infective conditions like tuberculosis or any other sort of pyogenic infection. Or sometimes whenever there is a trauma and there is a discontinuity in the elements of the spine, that can also lead to back pain. So normally these are six most common reasons for back pain. And except for this, there are other minor issues also like tumors or cancers, but those are rare.
So, Dr. Himanshu, what are some warning signs that a person should seek medical attention for back pain?
Yes, this is a very important question because not every back pain needs medical attention. But a back pain that has been there since more than 2 to 4 weeks, definitely it requires attention. Secondly, a back pain that is not going away with painkillers, that also requires medical attention. Thirdly, a back pain which is affecting daily activities, that also requires a medical attention. And fourthly, back pain that is associated with nerve related symptoms. By nerve related symptoms, I mean like if somebody is having back pain and there is a pain radiating down the leg, that is a nerve related symptom. Or if sometimes somebody has a back pain and there is a problem in passing urine, then that can also be attributed to nerve related symptoms. So essentially, these four conditions, a back pain which is more than 4 weeks definitely requires medical attention, or a severe back pain for more than 2 weeks, or a back pain which is not going away with medicines requires medical attention, or a back pain which is there and it is also pressing the nerve or there are nerve related symptoms, that also should be evaluated by a medical professional.
So, Dr. Himanshu, how can a patient differentiate between acute and chronic back pain?
So normally we say any back pain that has been there for more than 3 months is a chronic back pain. Acute back pain is basically something that has been there for less than 2 weeks. And between 2 weeks to 3 months, there is something known as subacute back pain. So subacute back pain typically means that a pain that has persisted between 2 weeks to 3 months, and intermittently there are flare-ups of pain. So this is the medical definition of acute back pain or subacute pain or chronic pain.
Dr. Himanshu Tyagi, what are the most effective non-surgical treatments for back pain if someone don't want to opt for surgical treatments?
Yes, this is a very good and important question because not every back pain patient is a candidate for surgery. In less than 4% of the cases only we need surgery. So basically, if somebody is fat or overweight, then he should definitely try to reduce his weight. That is one important factor that he can modify and get rid of his back pain. Similarly, second thing is if somebody is not exercising, then definitely he should go for exercises like extension exercises or spinal muscle strengthening exercises, or sometimes core muscle strengthening exercises are required. So these exercises are equally important in taking care of the back pain. Third is if the sitting posture is not good. Like supposing today I'm sitting on this perfectly fine office chair, so my posture is good. But sometimes if somebody is working from home and back pain is there, he's still not going for a proper office chair, working on sofas or on bed, then posture also plays a very important role. Except for this, fourth important thing that a person should do is, if at all his work requires a lot of traveling and the road is not good, then such vibrational injuries should also be avoided. So these four are basically non-pharmaceutical treatment options or modalities that a normal patient should do. Except for this, non-surgical pharmacological options is in the form of medicines like muscle relaxant or anti-inflammatories. But these are not treatment in itself. It is basically like the person should exercise, should do weight loss, should sit in a proper posture. After this, if required, then only you should go for medicines. Except for non-pharmacological options where we are not planning for surgery, but we are going for something which is known as invasive procedure, is pain block procedure. Pain block procedure is basically a daycare procedure where a person, if he's having persistent pain even after exercises, even after medicines, then we could give selective pain block injections under the X-ray vision in operation theater. In such situations, we specifically target the pain points and we try to alleviate those pain points and get patient back to his normal life. So normally these 6 options are there whenever somebody is looking for non-surgical treatment of back pain.
And Dr. Himanshu, when is surgery typically recommended for back pain?
Okay, so there are basically just 3 indications for surgery in case of back pain. First is if the back pain is severe and not going away by any of the before mentioned methods. So person has tried weight loss, he's doing exercises, sitting in good posture, has taken medicines, has taken block, but still the back pain is significant and affecting daily life. So in those situations, surgery becomes an indication. Second is if the factor that is causing back pain cannot be modified, like if somebody is having severe infection in the spine, there is instability in the spine or bone is getting destroyed, then in such situations also surgery becomes a must. And third situation is if the back pain is associated with nerve related symptoms, like if somebody is developing paralysis, like in case if there is any fracture, there is instability in the spine, back pain is there, and along with that nerve injury is also there. So if nerve related symptoms are also there, then of course surgery might be required.
So, Dr. Himanshu Tyagi, what are the different surgical interventions are there for surgery, and what are the potential risks associated with the same, and what are the benefits of it?
Okay, so basically in type of surgeries, there are 2 type of surgeries. One surgery is where we stabilize the spine. Stability if hampered or if there is instability in the spine, then sometimes we do surgeries which are called as spinal fixation and fusion surgery. In those surgeries, we may be required to put hardware, and when we put hardware, we stabilize the spine, and slowly there is a fusion between the bones of the spine that takes care of the back pain. Second type of surgery is where we need to open up the nerve or make the nerve free along with spinal stabilization. Like in situation like if someone is having tuberculosis of spine and the nerves are also getting pressed because of pus and the debris, also there is a bony destruction leading to instability. So in such situations, of course, surgery is required and the surgery becomes spinal fixation, stabilization with decompression surgery. So these are basically 2 type of surgeries done for back pain and nerve related symptoms. Now, coming to the complication part or the challenges, sometimes what happens if the nerve is involved or if there is any pressure on the nerve or if during the surgery there is some injury to the nerve, then of course chances of nerve injury or nerve related symptoms might happen. Also, whenever we talk about surgery, there are few general complications like wound healing or collection of blood inside, or in situations if the implant failure is there, or if at all the surgery everything goes well, but because of weak bone the implants cut out in the future. So few risks are always there associated with surgery. That is why when we are planning for spine surgery, we go with a proper technology backup, like we try to go for nerve monitoring. That means monitoring the nerve during the surgery. Also, using 3D technology or robotic surgery helps us in dealing in such complex and challenging situations so that we are able to give best possible outcome to the patient.
So, Dr. Himanshu Tyagi, are there any lifestyle changes that one can make to help alleviate their back pain, or what are some ergonomic tips that can help to prevent back pain, especially for those who work at desks?
Yeah. So basically, whenever you're working, your workplace or your ergonomics should be suitable for your spine. Like today, when I am sitting and doing this call over a laptop, the level of my laptop is almost the level of my eye, so that I don't have to bend my neck too much or put my neck in a extended position. Also, the position of my chair is just perfect. I am sitting comfortably, my lower back is well supported, my hands are well supported over the handrest, or I am supporting my upper body over the top of the table. So, in such situations, whenever somebody has to work on the laptop for long hours, your sitting posture or ergonomics should be suitable for your number of working hours. Also, you should exercise daily if you have a long sitting work hour. Like if you have to work for 6 8 hours, then you should definitely get up in between. After every half an hour, you should do 5 7 minutes of stretching. You should bend forward, walk around. Also, you should definitely do morning and evening back exercise. It will take hardly 10 minutes. And you should try to keep a healthy weight. By healthy weight, I mean that your weight should be around 30 percentile of your body mass index. So that is ideal and acceptable. If it is more than 35 or if it is 40, then it is definitely going to trouble you in future and give you back pain. Except for that, if you are traveling for long distances or if the road is not good, then car is a better option than bike, because bike or two wheelers transfer a lot of vibrational injury to the spine. So if you can afford a car and avoid bike or two wheelers, that would be best.
So, Dr. Tyagi, are there any specific dietary changes that can benefit people with back pain, and or are there any specific exercises that they can do at home?
Yeah, so basically for back, one should do spinal extension and core muscle strengthening exercises so that the front muscles of the spine as well as the back muscles of the spine are strong. It will take hardly 10 minutes, and if somebody can do it morning, evening, that would be best. As far as the dietary part goes, tobacco or smoking or alcohol definitely leads to dehydration of the disc. So that is why they say that back pain is very common in smokers. So high protein diet for building up good muscles and supporting your spine. Along with that, one should refrain from smoking alcohol or tobacco, especially in the young age, because it leads to early disc degeneration and back pain.
So, are there any common misconceptions or myth you would say about back pain that patients should be aware of?
Yes. So basically, the common myths about back pain is the most common myth is that one should sleep prone, that means on tummy, to get rid of the back pain. This is a totally wrong misconception, because sleeping on your tummy definitely leads to more back pain and improper positioning. So this is one very common myth. Moreover, people are over enthusiastic about exercise, and they say if at all you have some amount of back pain, chronic back pain, then you should definitely do uh, too much of forward reflection exercises. Like some people, they just start doing Surya Namaskar if they have some pain, and that can aggravate the pain like anything. So, whenever there is back pain, you should do exercises, but not extremes of exercises. And there is no one exercise that helps all. So, overall, what kind of exercise is to be done at what stage? This is a big misconception that people are having. Also, few people, they are of the opinion that you will not get back pain if your back is curved excessively. So basically what they do is sometimes they buy some products online like back support so that their spine is excessively curved or excessively supported. Even that is wrong. A very hard cushion, or if somebody is using a back support that is just supporting the lower back or causing it to cause more lordosis or curvature, even that is bad. So these 4 5 things, people are most of the time 70 to 80% of the patients who come to us in the OPD, they do mistakes in these 4 5 things. So these are some of the most common misconceptions in my opinion.
So, sir, any advice you would like to give to our audience today, or any topic that I have might missed to ask you that you want to cover?
More or less, we have covered almost everything. But one thing that comes to my mind is about back pain and pregnancy. I'm sure a lot of our audience are either of that age group where they must be planning pregnancy or post pregnancy. So, one common mistake about pregnancy or post pregnancy back pain is there are special type of pregnancy yogas or special type of pregnancy exercises uh, taught by experts, either physiotherapists or yoga experts. So a lot of ladies during pregnancy, especially after the first trimester, they are not able or not very comfortable in doing exercises. But exercises are very important during pregnancy and also after pregnancy, because back pain in pregnancy is a big problem. It is a very underdiagnosed disease, but it is very prevalent, especially because in India, if you talk about, females tend to put on a lot of weight during pregnancy, and it takes some time before we can shed that weight. So, what happens with extra weight, less exercise, low muscle tone? Invariably, females they end up with back pain. So, during pregnancy or after pregnancy, it is important to do 3 things if you want to get rid of back pain. First is you should definitely do back exercises or pregnancy yoga for under the supervision of somebody who is an expert and who would tell you what kind of exercises you can do what at what stage of pregnancy. Second is to prevent back pain during pregnancy, you should definitely sleep on your sides, and whenever you are sleeping, you should keep your legs folded, because that will take off the pressure from your spine. Because later on during the months of pregnancy, all the weight is carried at the front of the spine. So you should sleep on the sides with your legs folded. And third instruction is for post pregnancy ladies. After pregnancy, whenever the ladies, if they're supposing they're feeding the child while sitting, the posture should be good. And also, one should use a feeding pillow, because feeding pillow helps to take off the pressure from the female's hand, the mother's hand, and supports the kid very well. So, a feeding pillow after pregnancy, whenever a lady is feeding the kid. Secondly, it should not be done in sitting position. Best is if you can lie down on the side and then feed. But if you have to feed while sitting, you should definitely use a feeding pillow. And diet is very important post pregnancy also, because once the pregnancy is over, your diet should be directed towards weight loss. Otherwise, if the weight is more, patients invariably end up with back pain. So this was one more additional type of back pain that I always want people to discuss and come forward and ask questions about pregnancy related back pain, because this is not a very commonly discussed topic, but it is very prevalent.
Thank you, Dr. Himanshu Tyagi, for sharing your valuable insights with us on back pain and its effective treatments. And your knowledge and experience have truly been enlightening us. So, I guess we have learned a lot about the causes, symptoms, and various treatment options available for back pain. From conservative approaches like physical therapy and pain management to surgical interventions when necessary, Dr. Tyagi has provided a comprehensive overview. To audience, remember prevention is key. Maintaining a healthy lifestyle, practicing good posture, and staying active can go a long way in preventive back pain. If you are experiencing back pain or any symptom of it, don't hesitate to seek professional help. Thank you all for joining us today. We hope you found this session informative and helpful. Stay tuned for more health and wellness with Friday live sessions. Thank you, Dr. Himanshu Tyagi, for joining us today. Have a great day ahead.
Thank you for having me here. All the best.
Thank
Bye.
you, sir.